Bonjour and welcome for participating in today's technical briefing on the COVID-19 vaccine rollout focusing on logistics. Bienvenue au brefage technique d'aujourd'hui sur le vaccin contre la COVID, focusant sur la logistique. Today we'll start with opening remarks from Dr. Howard Njoo, Deputy Chief Public Health Officer, as well as Major General Dany Fortin, Vice President Logistics and Operation at the Public Health Agency of Canada. Our two spokespeople today will be accompanied by a number of experts from different federal departments, starting with Dr. Supriya Sharma and Marc Berthiaume from Health Canada, suivi au téléphone de Madame Ariane Reza, Assistant Deputy Minister for Procurement Branch for the Procurement Branch at Public Services and Procurement Canada, as well as Dr. Evan Adams from Indigenous Services Canada, and finally Colette Kaminski and Cheryl Guinenberg from Innovation Science Economic Development Canada. After the remarks, we will take questions from the media. Note that the content of today's briefing is for attribution. We will now start the session. Over to you, Dr. Njoo.
Merci, Eric. Thank you. Good afternoon. Good morning. The purpose of this briefing is to bring you up to date on the government's plans to make COVID-19 vaccines available to all Canadians. Today, I will be speaking about the vaccine rollout. Then I will turn it over to Major General Dany Fortin, Vice President of Logistics and Operations for the Public Health Agency of Canada. After that, subject matter experts from the Public Health Agency of Canada, Health Canada, Public Services and Procurement Canada, Innovation, Science and Economic Development, and Indigenous Services Canada will be available to answer your technical questions. So let me begin with an overview of the vaccine rollout. At this time, we are preparing for one of the most ambitious and complex vaccination programs ever delivered in this country. We will immunize as many Canadians as possible, as quickly as possible, and ensure that high-risk populations are prioritized. The Government of Canada is working closely with the provinces, territories, Indigenous and public health partners to ensure that this process is timely, fair, and well-coordinated. Canada is well-positioned to provide access to safe and effective COVID-19 vaccines to all Canadians in 2021 and has negotiated agreements with 7 promising vaccine manufacturers. This is welcome news and offers a light at the end of the tunnel. And while safe vaccines will not be our only needed defense, they will be our biggest artillery in the months ahead. As I mentioned earlier, we expect certain Health Canada approved vaccines to become available in early 2021. The initial supply of these vaccines will be limited such that we will be able to vaccinate about 3 million Canadians. That means we need to be strategic about who gets vaccinated first. The federal government has sought the best scientific advice possible to identify the high priority groups that will most benefit from an earlier vaccine while reducing the spread of the virus. One of the groups that provides recommendations is the National Advisory Committee on Immunization, or NACI. This expert committee released its preliminary guidance on key populations for early COVID-19 vaccination and outlined a targeted vaccination program. In the days coming, they will publish new guidance that further refines these key populations. It is also important to note that we are actively engaging with Indigenous leaders on how rollout should happen in their communities. Although the initial supply of COVID-19 vaccines will be limited, I want to be clear that there will be enough vaccine for every Canadian. Having said that, in a country as geographically large and diverse as ours, we are facing some logistical complexities. The need for ultra-cold storage for specific vaccines, reaching remote communities, and coordinating between orders of government, to name just a few. Today, we will be focusing on track 1 of the COVID-19 vaccination, the vaccines we expect to be earliest through the regulatory gates and receive approvals from Health Canada. We'll be back next week to talk more about track 2. Typically, vaccines go from the manufacturer to the provinces and territories. However, certain COVID-19 vaccines will require a different approach due to their novel nature. They will have different sets of logistical considerations. For the ultra-low temperature vaccine that needs to be kept at very cold temperatures up to minus 80 degrees Celsius, they will be delivered directly from the manufacturer to the point where the vaccination is given and be transported by assets controlled by the manufacturer. For the minus 20 Celsius frozen vaccine and others, they will be transported by a federally contracted logistics service provider from the manufacturer to the point of delivery identified by the provinces and territories. Ultimately, each provincial and territorial government is responsible for deciding how to deploy COVID-19 vaccines within their jurisdiction and immunizing Canadians with the support of provincial and territorial healthcare workers. When it comes to overcoming these kinds of challenges, we have brought on board some of the most highly experienced logistical experts in Canada. The National Operations Centre within the Public Health Agency of Canada will maintain eyes on the entire distribution process and is ready to respond to ensure the integrity of the distribution chain is maintained throughout the process. I'm very pleased that the Canadian Armed Forces and the Public Health Agency of Canada will be working together on the delivery of Canada's COVID-19 vaccines. And now I'd like to introduce Vice President of Logistics and Operations for the Public Health Agency of Canada, Major-General Dany Fortin, who's in charge of that effort. Welcome to the team. Maintenant en français. Bonjour. L'objectif de la séance aujourd'hui est de faire le point.
Good afternoon. The purpose of this briefing is to bring up to date on the government's plans to make the COVID-19 vaccines available to all Canadians. Today, I will be speaking about the vaccine rollout. Then I will turn it over to Major-General Dany Fortin, Vice President of Logistics for the Public Health Agency of Canada. After that, subject matter experts from Public Health Agency of Canada, Health Canada, Public Services and Procurement Canada, Innovation and Innovation, Science and Economic Development, and Indigenous Services Canada will be available to answer your technical questions. So let's begin with an overview of the vaccine rollout. At this time, we're preparing for one of the most ambitious and complex vaccination programs ever delivered in this country. We will be immunize as many Canadians as possible, as quickly as possible, and ensure that high-risk populations are prioritized. The Government of Canada is working closely with the provinces, territories, Indigenous and public health partners to ensure that this process is timely, fair, and well coordinated. Canada is well positioned to provide access to safe and effective COVID-19 vaccines to all Canadians in 2021 and has negotiated agreements with 7 promising vaccine manufacturers. This is welcome news and offers a light at the end of the tunnel. And while safe vaccines will not be our only needed defense, they will be our biggest artillery in the months ahead. As I mentioned earlier, we expect certain Health Canada-approved vaccines to become available in early 2021. The initial supply of these vaccines will be limited such that we will be able to vaccinate about 3 million Canadians. That means we need to be strategic about who gets vaccinated first. The federal government has sought the best scientific advice possible to identify the high-priority groups that will most benefit from an earlier vaccine while reducing the spread of the virus. One of the groups that provides recommendations is the National Advisory Committee on Immunization, or NACI. This expert committee released its preliminary guidance on key populations for early COVID-19 vaccination and outlined a targeted vaccination program. In the coming days, they will publish new guidance that further refines these key populations. It is also important to note that we are actively engaging with Indigenous leaders on how rollout should happen in their communities. Although the initial supply of COVID-19 vaccines will be limited, I want to be clear that there will be enough vaccines for every Canadian. Having said that, in a country as geographically large and diverse as ours, we are facing some logistical complexities. For example, the need for ultra-cold storage for a specific vaccine, reaching remote communities, and coordinating between the various orders of government. to name just a few. Today, we will be focusing on track 1 of the COVID-19 vaccination, the vaccines we expect to be earliest through the regulatory gates and receive approvals from Health Canada. We'll be back next week to talk more about track 2. Typically, vaccines go from the manufacturer to the provinces and territories. However, certain COVID-19 vaccines will require a different approach due to their novel nature. They will have different sets of logistical considerations. For the ultra-low temperature vaccine that needs to be kept at very cold temperatures up to minus 80 degrees Celsius, it will be delivered directly from the manufacturer to the point where the vaccination is given and be transported by assets controlled by the manufacturer. Provided from the manufacturers to the point of delivery will be identified by the provinces and territories. And we will help with the support of provincial and territorial health care workers. For the minus 20 degree frozen vaccine and others, they will be transported by a federally contracted logistics service provider from the manufacturer to the point of delivery identified by the provinces and territories. Ultimately, each provincial and territorial government is responsible for deciding how to deploy COVID-19 vaccines. The National Operations Centre within the Public Health Agency of Canada will maintain eyes on the entire distribution process and is ready to respond to ensure the integrity of the distribution chain throughout the process. I'm very pleased that the Canadian Armed Forces and Public Health Agency of Canada will be working together on the delivery of Canada's COVID vaccines. Let me now introduce Vice President of Logistics for the Public Health Agency of Canada, Major-General Dany Fortin, who is in charge of that effort. Welcome to our team. Over to you, Major-General Fortin.
Merci beaucoup, Dr. Njoo.
Thank you, Dr. Njoo.
Let me start off by saying that it's that I feel privileged to join the team, to lead a team of experts and professionals from the Public Health Agency and the Canadian Armed Forces in the Vaccine Rollout Task Force. Our job is to sort out the logistics of it all, to plan, to execute the distribution to ensure Canadians can be safely immunized against COVID-19 as quickly as possible. There will be multiple vaccines that will move from manufacturers to provinces and territories in the coming weeks and months. The team is working to ensure that all necessary equipment and material needed to distribute the vaccines is made available to all agencies, all organizations. CAF personnel, Canadian Armed Forces personnel have been involved in the federal government's response to COVID-19 from the very beginning. We're embedded now at the core of Public Health Agency of Canada's logistic planning team and established a national operations center, a sort of control hub that is managing and tracking the distribution of vaccines from the point they are released from the manufacturers to the point of delivery identified by provinces and territories. The National Ops Center will coordinate closely with provinces, territories, and other government departments, and will have the minute-to-minute capability to adjust, to reach in, to implement contingency plans, to mitigate any disruption to the distribution. So we're very much executing a whole-of-nation approach. So let me describe how we will deliver an approved vaccine to all Canadians. So Canada has a robust governance framework for coordinating, collaborating, and sharing information across all levels of government. These government bodies have been meeting on a regular basis throughout the pandemic and helping to merge clinical and logistical planning aspects at many levels. What makes this pandemic and this public health immunization campaign special or different is the speed, scope, and scale at which it is unfolding. Now, military expertise can be real added value here because it speaks to our core business of managing large, complex situations. Together, we are rapidly scaling up capacity, adapting the distribution chain to the unique vaccine characteristics and different roles and manufacturers in the delivery process. As mentioned before, there are unique logistical challenges specific to each vaccine candidate. Each Track 1 COVID-19 vaccine candidates introduce the additional complexity of both the ultra-low temperature and the frozen cold chains. The freezers, both ultra-low temperature and -20 freezers, have been purchased. We're closely tracking delivery and installation timelines, as well as distributing them to the provinces as they arrive. Dry ice contracts are being put in place. Ancillary equipment, vaccine-related ancillary equipment is being assembled and pushed to the different key transfer points in the cold chain. The ultra-low temperature -20 frozen vaccine candidates are coming first, commencing in January. For the early release COVID-19 vaccines, the Track 1 vaccines, ordering and demands from provinces and territories will be managed and coordinated through the recently established National Operations Center. The Pfizer vaccines will be delivered directly by manufacturers, as mentioned before, to points of use as identified by the provinces. From there, healthcare workers will work within their own jurisdiction to immunize Canadians. Pfizer is the only manufacturer that delivers this way. Different processes, different delivery for other ones. To distribute the remaining vaccines as they come online, the agency has been working very closely with Public Services and Procurement Canada and industry stakeholders to establish a logistics service provider contract to safely manage and distribute vaccines from the manufacturer to those points of delivery identified by provinces and territories. They will then coordinate the onward flow of vaccines to those points of administration based on their internal plans and resources. This will be the case, for example, for Moderna with the -20 frozen chain. The agency has been working closely with government procurement experts, industry, various health authorities to ensure that all the ancillary equipment, such as needles, syringe, the swabs, alcohol swabs, the PPE is plentiful, that it's pushed forward and delivered across Canada so it can be pre-positioned in support of vaccine rollout. The National Emergency Strategic Stockpile Team has been securing those sources of supply with private service logistics providers to build its stock and has started to push this week to all provinces and territories across the country. Through this, we continue to closely work federal, provincial, and territorial authorities to determine and enhance our collective level of readiness. Think of it as conditions-based. Where vaccines must be available and approved for use in Canada, the cold chain must be secure. The necessary equipment, ancillary equipment, needs to be in place. The education material needs to be available. The healthcare providers or the professionals have to be comfortable with the use of this material and follow the safety monitoring functions. We're seized with all elements of the rollout to ensure vaccines get to Canadians as quickly as possible and as they become available. We're also holding simulation tests to test the distribution plan in consultation with all partners, stakeholders, through a series of tabletop exercises and rehearsals, one of which occurred yesterday. This is to ensure that critical capability gaps are filled, the risks are mitigated and well identified, that the plan is resilient, contingencies are put in place, and it's the start of a dialogue with a number of interactors. In short, our plan is to secure movement of the vaccine supply chain from manufacturer to each of those individuals, each individual that will be immunized by a licensed healthcare provider in Canada. So we're very much collaborating at an unprecedented level with stakeholders and partners to plan and execute a timely, fair, well-synchronized distribution of vaccines to all Canadians.
Maintenant, en français, j'aimerais vous dire d'entrée de jeu, c'est un privilège, un honneur pour moi de joindre l'équipe de l'Agence de la santé publique du Canada, les professionnels chevronnés de l'Agence ainsi que les membres des Forces armées canadiennes dans cet effort. Notre travail consiste à régler les problèmes de logistique, à planifier et exécuter la distribution afin que les Canadiens puissent recevoir le vaccin contre la COVID sans encombre et le plus rapidement possible. Plusieurs vaccins passeront des fabricants aux provinces et aux territoires au cours des prochaines semaines.
In the coming weeks and months. Our team is working to ensure that all equipment and material needed to distribute the vaccine is available. CFA personnel have been involved in the federal government's response to COVID-19 from the very beginning.
Nous faisons partie du noyau
We're
de
now
l'équipe
part of the core
de planification logistique de
Public Health
l'agence.
Agency of Canada
Et tout
Logistics
récemment,
Planning
nous avons
Team and
établi
are
un
staffing
Centre
the
national des
National
opérations,
Operations
le
Center,
CNO,
the
qui est le
NOC,
centre de commande,
which is the
le centre de
control hub that is
commandement,
managing
habilité
and
à
tracking
et
the
suivre la distribution des
distribution of
vaccins depuis
vaccines
leur
from the
mise en
point that they
circulation
are
par les
released from the
fabricants jusqu'à
manufacturers
leur
to the
arrivée au
point
point de
of
livraison désigné
delivery
par les provinces et les
identified by the
territoires.
provinces and territories.
Le centre
The
d'opération
NOC
collabore
is coordinating
étroitement avec les
closely with the
provinces,
provinces,
les territoires et les
territories,
autres
and other government
ministères et
departments,
agences et pourra
and will
intervenir
have
à tout
the
moment et
minute-to-minute
mettre en
capability
place
to
des
implement
plans d'urgence
contingency
pour
plans to
réagir
mitigate
à tout
any
imprévu.
disruptions.
Alors, on applique
So
vraiment une
we're
approche
really executing
pan-canadienne
a
tous
whole of
ensemble.
nation approach.
Laissez-moi décrire maintenant comment on va
So I'd like
fournir
to
des
describe
vaccins
how we're going to
approuvés
deliver an
aux
approved
Canadiens.
vaccine to Canadians.
Le Canada dispose d'un
Canada
solide cadre de
has a
gouvernance pour la
robust governance
coordination,
framework
la
for
collaboration et
coordinating,
l'échange
collaborating,
d'informations
and
entre
sharing
les
information
autorités à
across
tous les niveaux
all
en ce qui a trait à
levels
la santé.
of
Ces
government.
organismes de
These
gouvernance se réunissent
governance bodies
régulièrement,
have
tous
been
les
meeting
jours,
on a
en fait,
regular basis throughout
depuis le
the
début de la pandémie et
COVID-19
ont aidé à
pandemic
fusionner
and helping to
la
merge
planification
clinical and logistical
clinique
planning
et logistique
at
à
many
plusieurs niveaux.
levels.
Ce qui rend cette pandémie tout à fait particulière,
Which
c'est
makes
la
this
vitesse à laquelle
pandemic
elle évolue, la
so
portée et
different
son
is the
ampleur.
speed with
Et pour ça, on a besoin de
we're able
solutions
to move.
appropriées.
And
Et l'expertise
we
militaire peut
will-
apporter une valeur,
And I
réelle
believe
valeur
that the
ajoutée
military
ici,
can be of real
parce que
value add here,
j'aime croire que nous sommes
because
des
I
experts
like
de
to
gestion
believe
de
that we
situations
are the
complexes et de
experts
grande
of
envergure.
complicated, multifaceted
Ensemble,
situations.
nous augmentons
Together, we are
rapidement la
rapidly
capacité
scaling up
en
capacity
adaptant la chaîne
and adapting
de
the distribution chain to the
aux
unique
caractéristiques particulières
COVID-19
des vaccins
vaccine
contre la COVID-19
characteristics
et aux différents rôles
and
des
differing roles
fabricants
of
dans le processus de
manufacturers
distribution.
in the delivery
Chaque
process.
candidat vaccin
There are
présente des défis
unique logistical
particuliers.
challenges specific to each
Les
vaccine
premiers
candidate.
vaccins
Early
contre la
Track 1
COVID
COVID-19 vaccine
à la
candidates
complexité de la tâche,
introduce
car
the
il doit
additional
être,
complexity
conservé à des
of both
températures
ultra-low
ultra
temperature
basses, sans bruit
and
de la chaîne,
frozen chain, cold
la chaîne
chains.
du froid, si vous voulez. Les congélateurs
Freezers
pour ces températures ultra basses et pour les
for
températures de moins 20
ULT and
degrés ont
minus
été
20
achetés.
freezers have been
Ils
purchased,
sont,
and we are closely
nous suivons de près les échéances.
tracking
Ils sont
delivery and
présentement en voie
installation
d'être livrés,
timelines and
installés,
distributing
et on
them
assure la distribution aux
to the
provinces dès leur
provinces
réception.
as they
Les
arrive.
contrats sont établis pour de la glace
Dry
sèche.
ice contracts are being
Les
put in
trousses de
place.
manutention
Handling
sont assemblées
kits are being
et seront
assembled and will be
installées aux
positioned
différents points
at
de
key
transfert de la
transfer
chaîne,
points
du froid en collaboration
in the
étroite
cold
avec nos
chain,
partenaires.
working with
Les
our
vaccins
partners.
qui sont conservés de température ultra basse et ceux congelés
Those
à moins
that
20
are
seront
kept in
les premiers à être
ultra
offerts
low temperature freezers
à
and
compter de
minus 20
janvier.
frozen vaccine candidates are
Pour les
coming
premiers lots
first
de
in
vaccins,
limited
les
doses
commandes et les
commencing in
demandes
January.
des provinces et des territoires seront gérées et coordonnées, sont en fait gérées et coordonnées par le Centre national des
The
opérations
National
que nous venons de mettre
Operations
sur pied.
Center
Le vaccin
will
Pfizer sera
coordinate
envoyé
this
directement
Track
par
1
le
vaccine.
fabricant
Pfizer vaccines
au
will
point
be
de
delivered
livraison,
directly
au
by
point
the
de
manufacturer
service
to points of
désignés
service
par les
as
provinces et les
identified by the
territoires. De là, les
provinces and
travailleurs de la
territories.
santé vont s'employer
And
à vacciner
Health
les
Canada
Canadiens
will look
sur leur
after
territoire. Et
vaccinating
Pfizer,
Canadians
dans ce
on
cas-là,
the
est le
territory,
seul
and
fabricant
Pfizer
à
is
livrer
the
directement
only
au point de
manufacturer
service.
that will deliver
Pour
directly to
assurer
point
la
of use
distribution
to
des autres
distribute the
vaccins,
remaining vaccines.
l'agence travaille en
The
étroite
agency has been
collaboration
working
avec
closely
Service public,
with
Approvisionnement Canada et les
Public
acteurs
Services
dans
and
l'industrie.
Procurement Canada and other
L'attribution
industry
d'un contrat
stakeholders
de fournisseur de services
to establish
qui gérera la procédure et assurera la
logistics service
distribution
provider contract
sans
to safely
encombre des
manage
vaccins
and distribute
du lieu de
COVID-19
fabrication
vaccines from the
jusqu'au lieu
manufacturer
où
to
les,
points of delivery
désignés par les provinces
identified
et
by the
territoires
provinces and
après la livraison.
territories.
Les provinces et territoires vont ensuite
They in turn will then
coordonner
coordinate
l'acheminement des vaccins
the
vers
onward
les
flow of
points de
vaccines
service
to points of
où les
use
professionnels de la santé pourront
based
administrer
on their internal plans and
les
resources.
vaccins, et ce, grâce à leurs ressources à l'interne. C'est certainement le cas de Moderna
This will
avec leur
certainly be
chaîne
the
de
case
froid,
for Moderna
de moins 20
vaccines
degrés.
with a minus 20 frozen chain. The agency has been working closely with government, procurement experts, industry, and the various health authorities to ensure that ancillary equipment
ce qui a trait à la distribution, comme les aiguilles,
such
les
as
seringues,
needles,
les tampons d'alcool,
syringes,
l'équipement de
alcohol
protection,
swabs, and
tout ça
PPE,
soit mis à la
so that
disposition,
all this
qu'on n'en manque pas,
is plentiful.
et que ce soit distribué
And this
partout au
equipment will
Canada.
also
Cette distribution a
be
commencé
delivered
cette
across
semaine.
Canada.
Afin que
It'll
ce soit,
start this week
afin que les
so
différents
that
acteurs
they
soient en
can be
mesure de
pre-positioned
soutenir
in
l'initiative de
support of
vaccination.
vaccine rollout.
L'équipe de la Réserve nationale stratégique d'urgence
The National Emergency Strategic Stockpile Team has been securing sources of supply with private sector logistics. And as I said, this began on Monday. We are working closely with federal, provincial, and territorial authorities to determine and enhance our collective level of readiness. Think of it as conditions-based, where vaccines must be available and approved for use in Canada. The cold chain must be secure. Then the ancillary equipment must be in place. The necessary education materials and training must be available and completed. Experts have to be comfortable with the use of the equipment. So we are going to ensure through the NOC that everything is done as quickly and safely as possible as soon as the vaccines are available. So we are holding simulation tests of the distribution plans in consultation with the province and territories and partners through a series of tabletop exercise and rehearsals. There was one yesterday. This is to ensure that critical capabilities are filled, that risks are mitigated, that the plan is resilient, and so that we can deal with any type of contingencies. In short, our plan is the secure movement of the vaccine supply chain from manufacturer to each individual that will be immunized by a licensed health care provider in Canada. So, our level of cooperation is without precedent. We are collaborating very closely to ensure that we have a timely, fair, and well-synchronized rollout of COVID-19 vaccines to Canada. Thank you.
Merci beaucoup, Major Général Fortin.
Thank you, Major General Fortin.
Vous pouvez poser vos questions dans l'une des deux langues
You can ask your question in any official language.
And only one follow-up. For those asking questions in the room, we ask that you make your way over to the freestanding mics. We will start on the phone, as usual, for 3 questions. Operator, over to you.
Thank you. The first question is from Mia Rapston from the Canadian Press. Please go ahead.
Hi, good afternoon. I have a question just about sort of when the military was called in to begin helping, when that sort of started, and when the actual participation of military members will begin. I'm told it might be as early as next week. I'm just wondering if you can walk us through a little bit about when the timelines of all of that, how that happens.
Thank you for the question. It's Dr. Njoo. I'll start. As Major General Fortin also indicated, we've been working closely with military from the Public Health Agency of Canada perspective for many months. It's right from the beginning, and so it's only, I think, in the last little while that I think there's been more attention paid to that collaboration. But with that, I'll pass it on to Major General Fortin to elaborate in more detail.
Thank you. Yes, we've been working for many weeks. If you recall, back in the early days of the pandemic, the agency was busy with procuring protective equipment, managing the stocks. The Canadian Armed Forces helped in that regard. I can tell you specific to this, the rollout of vaccines, CAF, Canadian Armed Forces planners have been engaged in that for many months. The planning has started in the spring, late spring, and physically at the agency, we've had people there for weeks. I just happened to have, with a small team, been added to the agency, provide a little bit of relief, and really begin in earnest the execution of this plan. So this is an appropriate time to do that, and we're lined up as I described earlier, we're lining up all those activities to ensure that we are ready when the vaccines are approved and arrive in Canada.
Thank you. Follow-up.
And my follow-up, I'm not sure who this would be directed to, but knowing that the approval hasn't come yet, do we have actual dates for when the Pfizer vaccine in particular is going to start arriving? I know we talked last week that there was the possibility for pre-positioning. Just wondering if that is any chance that is going to happen, and if we know how many doses will be in that very first shipment.
Okay, it's Dr. Njoo. I'll start off. Certainly, like as I've said previously at press conferences, there are a lot of moving parts. So certainly we're optimistic with the Pfizer vaccine, also Moderna and several others. They're in the approval process. As my colleague, I'll pass it on to her shortly, Dr. Sharma has said, we expect a decision soon, and certainly we expect it to be a favorable one. But in the meantime, we're not just sitting still and sitting on our hands. We've been actively having discussions at all levels of government, obviously with Minister Anand and others, but also with ourselves at the technical level in public health, working closely with various partners to discuss the practical aspects from both a public health perspective in terms of if we actually get X number of doses, who would be the priority groups to be vaccinated first, et cetera, and so on. And then certainly on the logistical side, Major-General Dany Fortin and his team has certainly been very implicated. So maybe I'll pass it on to Dr. Sharma. Nothing to add on? Oh, okay.
Sure. Well, just to say that, the review is progressing. Yeah. It's progressing very well. We're still waiting for some key pieces of information that will be coming in over the next few days. Part of that information is really around the manufacturing process and which specific lots may be destined for Canada. And it's really important that we get that information and we have good information about the quality assurance checks on those. So once we get that information, we'll have a little bit more idea of the timing.
Thank you, doctors. Operator, next question.
No, maybe I just add, I'm not sure Major General Fortin wants to add to in terms of some of the logistical aspects of the vaccine.
Thank you. I think I could add a little bit more granularity in terms of the logistics aspect. Just to paint a picture of month of December, we set up the National Operations Center. I can tell you now that it's up and running. It's running 24/7. We're in close coordination with provinces and territories on a daily basis, multiple levels, but certainly the National Operations Center. As I described earlier, there are existing stocks in terms of ancillary to vaccine-related medical supplies, but we're also amplifying that or adding to it as we're in the process of distributing, and in a very short order, the provinces and territories will have what they require for the first quarter. We're also what I would call executing a soft launch. The initial sites have been identified, one or two, depending on the province. Every province has identified a site for the Pfizer rollout, and we'll do, as I explained, rehearsals earlier. We'll continue to have other rehearsals and tabletop discussions in the coming weeks and months. But on Monday, the 7th, we'll have a dry run in every province, and they will execute, and they'll ensure that without the vaccine, of course, they execute the process of handling and ensuring that people are comfortable with this very unique requirements of handling a ultra-low temperature vaccine. So that's happening. By the 14th, the model points of use in those provinces are expected to be ready in all respects, ready to receive a vaccine. The logistics service provider will be onboarded by 15th of December. That has to do with the Moderna rollout. So this gives you a sense that in December, we're hard at it in the next couple of weeks to ensure that we are ready. And I kind of like the idea of being ready before the Christmas time frame so that we're certain to be ready when it comes in January. En totalité? Ouais, certainement. Alors en français,
in French, I would say that to provide more details about readiness in December, in addition to what I explained earlier with respect to the discussions and simulations that we've done yesterday with participants throughout the country, we are establishing the National Operations Center, which is working 24/7. We're in the process of confirming things with provinces and territories, the stocks, the material required to proceed with the vaccination, as I explained earlier, but we're really pushing out the material to ensure that everyone has a quantity, an adequate quantity. We also are doing a gradual process. In addition to the practices I talked about earlier, we're doing a rehearsal without the vaccine to ensure that each province is able to carry out the process properly. This has taken place on Monday. According to Pfizer, Health Canada officials will work to learn how to handle this type of process when we're dealing with ultra-low temperatures. The model clinics, the points of use in each province will be established. We're discussing matters with provinces that should be ready by December 15th. The logistical providers will have been identified, and they will be ready to roll this out. So that gives you an idea. This is for Moderna. That gives you an idea of the level of preparation that we are now trying to achieve over the next few weeks. And as I said earlier, we will be ready before Christmas. We'll have all that ready in the field so that we can be able to tweak everything so that we'll be ready for distribution in January. Thank you very much. Next question. Thank you. Question. I don't know who can answer this question, but Premier Legault said he was talking about 700,000 doses. Are we talking about 700,000 doses that Quebec is expecting in the first semester, or the equivalent? So 1.4 million doses. Thank you very much for your question. Maybe I could begin and give you the Health Canada perspective, and I'll turn the floor over to Major-General Fortin. Yes, this is a hot topic. We are continuing to discuss matters with our provincial and territorial counterparts. There are many different discussions underway with the committee members, and here I refer to the NACI, the National Advisory Committee on Immunization. We're talking about the number of doses that we can expect to receive, what are the factors involved, and we will consider the population as a basis, of course, but we also know that there are high-risk groups, such as what priority groups need to be immunized first. So we're continuing these discussions. Pardon me. He talked about 17,000. Is there someone with you who could tell us how many doses are we talking about 4 million? It's a very specific question. I'd just like to have a specific answer, if that's possible. We talked about 6 million doses for the promising Pfizer and Moderna vaccines for the first quarter. We've done some calculations. We've talked to all the provinces and territories. I don't have all the figures in my head, but I think we have a basis for our discussion now, and this is ongoing. So you're not answering my question. I heard on Montreal radio saying that they're waiting for Pfizer approval, and that should come on December 10th or 11th. Can you confirm, is that the case? Good morning. Thank you for your question. During the interview, I didn't mention any date, but what I did say is that Health Canada works actively to approve the Pfizer vaccine over the next few days or weeks, but we don't have a specific date. We explained that you have to think about various characteristics that apply to in Canada. I also said that Canada is ahead of the list for receiving the Pfizer vaccination. We should. We're not far away from the approval. The FDA is about to approve it, and the European Agency for Drugs is about to approve it as well. Thank you very much. Next question. Thank you.
Next question is from Charlie Pinkerton from iPolitics. Please go ahead.
Hi, thanks. Thanks for doing this. I'm just hoping for an update on some of the involvement of private companies, those including FedEx, Kuna, Nagel, McKesson Canada, and UPS, who are asked to submit bids to be a part of the distribution process, as well as Purelator, who's lobbying the government for final mile logistics support involvement. So I'm just wondering if, what details can be shared about any of these companies' involvement at this point.
Thank you very much for the question. I'll pass that on to Major General Fortin.
So as I said before, we are going to contract a logistics service provider. This is something that's done as a team between the agency and Public Service Procurement Canada. I believe we have someone who could speak to this in greater detail, but I'll just say this. We require logistics service providers to distribute across the country. It's the size and scale of this problem is unprecedented, and there's a number of factors being at play. So we'll closely monitor and work with the contract or the service provider to follow very closely the distribution across the country. But I'll pass it to my colleague.
Yeah, it's Dr. Njoo. We also have colleagues online. Ms. Ariane Reza, who's the Assistant Deputy Minister at the Public Service and Procurement Canada. So I'll also pass the mic on to her.
Thank you. So yes, Public Services and Procurement Canada has recently done a competitive tender to procure to services one or more logistic firms for the effective distribution of vaccines to Canadians. This includes elements like transportation and storage. So we have pre-qualified 4 suppliers. You named them earlier in your incoming question that have the capabilities to meet Canada's requirements, including a readiness to deploy. So we're aiming to have 1 or more contracts imminently, and we've heard General Fortin refer to the December 15th date. And I would just add to this that, Canada is a country that is large geographically, and we have a very strong transportation sector. So we are anticipating being ready to roll very quickly on awarding the first contract. Thank you.
Thank you. Follow-up question?
Okay, thank you. That's helpful. Something else, I might be confused about something here, but with Pfizer delivering its own vaccines to certain points because of the temperature needed, what's happening, or what's going to happen with all those cold freezers that the federal government bought? I believe there's dozens. Have they been parked in certain parts of the country, or where have they been sent at this point?
It's Dr. Njoo. Thank you for the question. I'll pass that on to Major General Fortin.
Yeah, so there are organizations in the country that had ultra-low temperature freezers already. Provinces had an opportunity to indicate their requirements so that Pfizer can distribute to locations that have a ultra-low temperature freezer in place, certified, the whole thing. We are currently working with provinces and territories on a initially I mentioned 14 sites. So once we get that ready and we qualify at all levels of personnel, we can turn on additional points of use. The planning figure right now is 205 points of use across the country. So there are in-province capabilities. There are additional capabilities of capacity that's being pushed by the federal to those provinces to meet that requirement.
Thank you very much. We'll now turn on in the room. We'll start with the first question, Radio-Canada.
Bonjour, Juliane Lapointe de Radio-Canada. Donc, vous avez parlé des imprévus qui étaient possibles.
Unforeseen circumstances we have to expect. That could you tell us would be the most significant and probable circumstances that will have an impact on distribution? Answer.
Merci.
Thank you. During yesterday's discussions, we had more than 150 participants from all provinces and territories, 8 different departments and agencies of the federal government, experts, all of these people were able to exchange info on various factors and risk factors and came up with potential solutions. We're going to have subsequent discussions because certain risks were identified and we already have good mitigation plans in place. We want to ensure that we have a good ability to exchange information. I was pleasantly surprised to see to what extent people are prepared to share their experiences and ideas, good practices during yesterday's discussion. As an example, we don't all agree on the probability level of a certain risk, but we talked about risk in general. We talked about things like, Canada, winter, remote communities. We could have a problem with the temperature. So what does that mean for distribution? What impact will that have? If we have a problem pertaining to a key site, whether it be abroad at the supplier site or here in Canada, how are we going to be able to remedy that problem and continue to provide vaccines in a timely way to Canadians if one of these points of use, if the transfer point is having difficulties, particularly in the frozen chain? If there is an accident, a highway accident, would there be a problem? Not in terms of transmitting disease, but we have to anticipate certain problems per region. And what kind of staff do we have here in Canada that could help with the situation? If there's a problem with the freezers, if there's just one on the site that is malfunctioning, that's a problem. Do we have a capacity? What about can we use dry ice? So there's all kinds of things that are being discussed and were discussed yesterday, and this is an ongoing discussion. We all agree that there as to possible solutions. Yes, in a poll yesterday, many Canadians say that they prefer to wait until they get vaccinated in case of any side effects. What if you find out that people really aren't all that comfortable getting vaccinated? Are we going to adjust anything? Thank you for that question. I'd like to begin. Yes, the National Advisory Committee on Immunization looked into this matter. People need to have confidence in the vaccines. That's always an issue in the scientific realm. We plan for this because there are some parameters for the vaccine. We're expecting 6 million doses, but as an example of a parameter, maybe 67 or 75% we're going to require special treating. And we also planned for the 5% waste that could occur. So these are all factors that we have to take into account in our discussions with our provincial Ontario counterparts. We're also working closely with our communications experts because it's important to communicate well to Canadians, to explain that only effective vaccines will be given in Canada. We have a very robust, one of the best regulatory systems in the world. So I think that all Canadians can have confidence in our regulatory system as soon as these products arrive here in Canada. Thank you very much.
Next question, Toronto Star.
Hi. I've listened carefully to all the dates that have been tossed around, and I would like actually some clarification. We've heard conflicting information about whether or not doses from Pfizer or any other company would be pre-positioned on Canadian soil before Health Canada's approval. So I wonder if maybe Dr. Sharma or somebody else can give me an outline of roughly when you expect the Health Canada approvals for the 4 you're reviewing, and roughly when the supplies from those 4 will arrive in Canada.
Maybe I'll start. Certainly from the regulatory perspective, I'll pass it on to Dr. Sharma for sort of the timelines on that. But with the other aspects in terms of when you're talking about the logistics, about the vaccine actually then arriving and so on, certainly we will have others that can add to that besides Dr. Sharma. But I'll pass it on to Dr. Sharma first.
Sure. So I'll start with the regulatory piece. I think, the difficulty in terms of providing an exact date for an authorization is because the review is ongoing. So granted, we've had, I think it's been progressing really well. We've got the majority of information that's in, but we really do have information coming to us on a daily basis, and especially around specific lots about the manufacturing. So that's why it's difficult at this point in time to say, this is exactly the date that the authorization will come. Although we do think that it'll be soon. We do envisage that we're getting some very key information as tomorrow in terms of Friday, and then we'll be able to be, I think, in a better position to explain that. On the pre-positioning, what we said is that for all of the vaccines that have an advanced purchase agreement that's associated with it, and that they're under review, under the interim order process, there is the possibility to allow for pre-positioning. So we wanted to make sure that there is a pathway should a company have supply and have enough supply that it makes sense for it to be pre-positioned somewhere in Canada to try to avoid any delays in distribution. So a lot of those things that need to be in place really depend on the company's willingness, ability, and the availability of supply to do that. So at this point in time, we're really looking at the review process, the authorization, and simultaneously the companies are working through their scale up and all of their manufacturing issues, if they have any, and figuring out which supplies, which lots might come to Canada and in what quantities and what time. So that's why we don't have those precise dates yet. But we think that Pfizer will likely be the first because it's the most advanced in terms of the review process. Moderna is the one we have the most information in following. And for the other two, so both AstraZeneca and Janssen, we still have some information, but there's large chunks of information that are still left to be submitted for the review.
Thank you.
Yes, to add to that, it's Dr. Njoo here. I think as Major General Fortin has pointed out, I think we shouldn't be so obsessed about the quote actual delivery of the vaccines themselves, the dates and so on. I think what's really important is the fact that we're planning, preparing, doing exercise. The fact that we'll be ready doing the dry runs, the soft launch, so that once the vaccine actually technically arrives, then everyone will be ready. Everyone will be comfortable. The people will be trained, et cetera, to actually receive and utilize the vaccine. So I think that's the main point that we need to stress. And I'm not sure if Major General Fortin has anything else he would like to add.
I would only say that we're very much oriented on being ready when vaccines get approved, vaccines arrive in country. We're not going to wait till end December, and December being the month that it is. We're oriented on getting ready along the timelines that I indicated earlier, so that when that becomes possible, we're poised to support, poised to distribute.
And you spoke a little bit in French about the tabletop exercises that you've been conducting all along, one as recently as yesterday, and you spoke about some of the risks you've identified. Can you talk a little bit more about that and what you're using to run those exercises? Are you using a per capita distribution of vaccine, and what holes you're finding in the net?
Well, thank you. I guess I would tell you that the tabletop exercise, or the discussion that we had yesterday with over 150 participants, all provinces, all territories, 8 federal departments and agencies participated. This was the very first of that type. There have been all kinds of discussions, and there are discussions every day at multiple levels, but this was the first where we pulled everybody in virtually from across the country to have those discussions with experts providing insights, providing, injecting different perspectives that really force us to think, and all of us really listen to the different perspectives and the realities of the provinces or territories and so on. We looked at the first quarter, but also, okay, what does the second quarter look like? And my guidance to the team as we started was visualize where we want to be. We want to get vaccines out to person X. Okay, so let's work our way back. How do we do this? As we tackle the different steps, how do we do this? What's missing? What do we have to put in place? Now, there's the obvious ones, but there's the what if scenario. So what if we have, as I indicated earlier, bad weather in a country like Canada in winter? What does that do to remote and not so remote locations? What does a cyber event look like? What does that do to us? What does a physical security problem like a fire at a depot or a point of transfer or a location becomes compromised for whatever reason? What does that do? If a delivery just doesn't go according to plan for all kinds of reasons, accident, so should we maintain a bit of a reserve? Should we be prepared to reallocate within provinces, between provinces? Knowing that we're going to have a drip feed of doses every week. So it wasn't so much about numbers. It was about the process, ensuring that we have the process, regardless of numbers. What does the process look like? What are the risks? What are the possible mitigations? And that was very much the focus. I would end by saying that we also identified areas that probably require a little bit more a coordination. So we're very much aware of that at all levels, and we'll have additional discussions. And I also said this is not the first and last of those discussions. We got to have more to ensure that we have that clarity moving forward.
Thank you. Next question in the room, Globe and Mail.
Hi, Marika Walsh with the Globe and Mail. Can you please clarify the state of the planning that you are submitting to Pfizer and Moderna to show that we have the logistics in place? When will that be submitted to Pfizer and Moderna, and when are you expecting Pfizer and Moderna to sign off on Canada's logistics and distribution plan?
We have conditions that need to be met. I indicated some of those earlier. We have the training material. People are identified, trained, or comfortable with the process, the handling process, all the way down to someone being ready to vaccinate the person. Are we comfortable with that? Do we have the freezers in place? Do we have backups? Do we have this? Do we have that? So all of these things are being looked at very closely. We're in constant discussion, like daily, with Pfizer. I think multiple actors at Pfizer on specific logistics, and other aspects that are not necessarily my swim lane. But I would tell you that we are very much in a close coordination with all stakeholders and ensure that all provinces, all sites identified, the first sites identified. That's my first goal here. Ensure that we all have clarity among ourselves as what it is that's required. Pfizer is also comfortable with, I'd say, the level of readiness, and then we can execute. We're ready to receive and execute, even small at first, and we continue to replicate that and have those model points of use across the provinces with Pfizer and provinces and territories with Moderna and follow-on vaccine.
Follow up.
Okay, I didn't get an answer there on where you're expecting to get approval from Pfizer and Moderna for our logistics plan. It's not my understanding they will not be sending anything to Canada until that's approved. So if you could give us a date, or if you don't know a date, that's fine too. I do have another question though for Dr. Njoo about the vaccination records and how this is going to roll out, given that they do need 2 doses for each of these first vaccines. And given that they're different vaccines coming in, so what role is Ottawa playing in ensuring the coordination and oversight of the vaccines and the tracking so that everyone who is vaccinated gets the proper vaccines for the second time? Like, what role is Ottawa playing? Is that system also already in place? I don't know if both of you could just clarify that.
Okay, maybe I'll start with the vaccination sort of a record system that you're referring to, and then if Major-General Fortin has anything to add on the other question, that would be good as well. Yes, it's obviously a very important issue in terms of what we call record keeping. For the vaccinations, it's something that we've had active ongoing discussions with our counterparts in the provinces and territories. It'd be important to track, but I would also add that it's not just, quote, keeping track of who gets vaccinated with what dose and so on. One of the most important things in terms of our overall, what I call our vaccine safety system, is what we call our post-marketing surveillance. And I know our colleagues at Health Canada are also well aware of this, is that we also want to track in terms of what happens should there be maybe an adverse event. That's something that's been well established in place in Canada for other vaccines, and certainly we would build on that for a COVID-19 sort of vaccination sort of a data system as well. So it's all in hand, and the work's ongoing.
So just to answer the point that you raised, we identified the 14th of December as the date at which the initial 14 sites, one per province, some provinces two, so 14 sites are ready in all respects to receive vaccines and to provide that to Canadians. That's a date that is agreed to with provinces. Pfizer is aware of that date, and we're working with those sets of parameters.
We will now turn over to the phone for a few more questions. Just to say that our spokes also have a commitment for 1:30, so we're going to have to get questions going. So let's turn over to the phone. Operator, next question.
Thank you. La prochaine question est de Hélène Buzetier du Devoir. À vous la parole.
Good afternoon. The approval rate for vaccinations. In the case of the United States, I believe approval for Pfizer is going to be December 10th. Why in Canada aren't we able to set a date? I heard earlier someone said it's an ongoing process, but I believe it's an ongoing process in all of the other countries. Why in Canada are we not able to set a date the way other countries are?
C'est Marc Berthiaume. Merci pour votre question.
Answer.
Comme on a expliqué, les compagnies sont
we
sollicitées beaucoup pour, dans le fond,
companies
fournir des informations à travers le monde.
Are providing information throughout the world. In Canada, we're reviewing data and other data that we're finalizing. But what's important to understand is that we're headed towards an approval. We're not far from that. We're not far away from the FDA. And then we still have to obtain information with respect to the bids and the manufacturing processes. We'll be finalizing various aspects. For example, in Canada, there's the monograph. We have to ensure that all is done properly. We have to ensure that it respects all of the different rules of play in Canada. So it's a little bit different. So the approval process, we're expecting it, if everything goes well, if everything goes according to plan, it will be very close to the time when the FDA sets it. Thank you very much. I understand that official languages are something that has to be considered, but Tanda McCharles talked about the number of doses. You said that we were going to be getting vaccinations before they're even approved in Canada. Can you confirm whether, in fact, we have received doses? And if so, what is the breakdown for each of the vaccines? Thank you very much for your question. This is Dr. Njoo. We haven't received vaccine doses to date here in Canada.
Merci beaucoup. And we'll turn now to the room again. National Post.
You've spoken before about the possibility that our number of vaccines will rise considerably in Q2 and Q3. Can you give us some hard numbers on that? And as well, is that based on us getting more of the Pfizer and Moderna vaccine, or is that based on us approving more vaccines and also getting the AstraZeneca and the Janssen ones?
Yeah, it's Dr. Njoo. I can answer that question. Certainly, I think as Major General Fortin alluded to, and we've also said at the beginning that the number of doses that we anticipate receiving from both Pfizer and Moderna, based obviously on having regulatory approval is limited. It's 6 million in the first quarter. What I would say is also is that even the 6 million doses won't arrive all at once. They'll be almost like a freight train. You're getting sort of a regular shipment, sort of maybe on a weekly basis. And certainly Major-General Fortin and others, obviously in the provinces and territories, will be working very hard to make sure that, you know, we get that regular distribution out to where they need to be used, obviously, for vaccination. Discussions are ongoing, and certainly we expect many millions more of doses from both Pfizer and Moderna, if obviously everything goes well with the regulatory approval in the second quarter. I think the way I would characterize it is that sort of in the first quarter, it's limited. We're going to focus on the priority groups, make sure that they have access to the vaccine. But as the second quarter unfolds, and there's nothing magic, you know, in terms of, you know, between like March, end of March, beginning of April, obviously we intend to ramp up, and there will be more doses coming from both Pfizer and Moderna. So that's the good news. And even on top of that, I would say that we're also anticipating, if everything goes well with the other sort of 5 vaccine candidates, and they have good clinical results in their trials, and the data gets submitted to Health Canada for regulatory approval. If any one of those also gets approved, and we obviously have advanced purchase agreements with those vaccine manufacturers, then we'll have even additional vaccines to add to our suite of vaccines to be able to offer to Canadians.
And you've talked too about the first Pfizer and Moderna vaccines being sent to these 14 specific points. But you've also said that the first people to get these vaccines will be the elderly, people in long-term care homes, people who may not travel very well. So how do you coordinate that in terms of vaccinating people who might not be able to travel to a central point to get vaccinated? Are you going to go to long-term care homes and vaccinate people there?
I'll start off, and then I'll maybe pass it on to Major-General Fortin. Yes, those are actually the types of issues that we are actively discussing with our counterparts in the provinces and territories. What I would say is that the principles, the science, looking at our experience, what happened in the spring in terms of you know, groups at risk for severe consequences, I think everyone's on the same page. So you mentioned, for example, advanced age, residents and workers in long-term care facilities, healthcare workers, because obviously they're both at risk of being exposed, but also of transmitting it to patients who would be at greater risk of consequences, and so on and so forth. At the end of the day, with all of those factors put together, we certainly respect and understand that the final decision in terms of how the first doses are actually used in each province and territory will depend on sort of their individual context and circumstances. For example, the epidemiology and logistical factors included. So with that, I'll pass it on to Major-General Fortin.
I would simply clarify that the 14 sites, the points of use that I mentioned earlier, are for Pfizer. So that's the first vaccine we expect to see. But we're also in parallel working with the expectation that Moderna becomes available soon in the new year. So some of those points may also, with the right equipment, in addition to the equipment for Pfizer, meaning another different type of freezer and freezers to receive the Moderna doses. That's what we're also working on right now. So my close objective here is to ensure that we have those 14 sites. Provinces they intend on having their sites ready for mid-December, and that's really what we're closely paying attention to right now.
Thank you.
En français, bon, je vais simplement dire 14 sites. 14 sites, c'est pour Pfizer.
14 sites for Pfizer. We're also working with Moderna. We're going to be distributing this in the points of use. And in certain cases, it could be the same point of use, providing we have double equipment. We need to deal with ULT freezers and -20 freezers.
The military's planning directive says that in order for the supply chain to be ready by early January, they need a few things, a few decisions by no later than early December, including approvals, number of doses per province, and advice on priority populations. It is early December. So we haven't heard any of those answers to those specific points. Do you have them and you're just not releasing them publicly? And if you don't have them, how will you be ready for early January?
It's Dr. Njoo, so I'm not sure if I understood all the parts of your question, and I can speak from the public health perspective. I think what we're planning for, and we've said this repeatedly, is that we are anticipating, if all goes well, for the 6 million doses of the two vaccines, Pfizer and Moderna, once they get regulatory approval, to arrive in the first quarter in Canada. What we've also done is that, as I've said, we've gotten recommendations, but we've also had active discussions with respect to priority groups. So it's interesting, our National Advisory Committee on Immunization has given preliminary advice, and I think they're also, based on sort of latest developments and the science and so on, will be, coming forth with sort of more targeted sort of advice. But that's sort of one step in the process. Once they give us the advice to the Public Health Agency of Canada, we take that to our SAC table, the Special Advisory Committee, which I think the next meeting's in 10 minutes from now. So we'll be having our ongoing discussions about then, based on sort of looking at the delta between the 6 million doses we expect to receive, which is enough to immunize 3 million Canadians with a 2-dose schedule, looking at the priority groups, looking at a lot of factors, logistics, local epidemiology, obviously different provinces in terms of what they experienced in the spring and what they're actually experiencing now might vary across the country. All that's part of the mix in terms of what then we would recommend would be sort of the way forward in terms of specifically vaccinating specific groups. And then towards that end, obviously, Major-General Fortin and his team are looking at the logistics of how to operationalize that.
I think I was clear in my question that the military is saying if they don't have those answers by early December, then they can't be ready for supply chains by early January. But I don't want to waste my follow-up question, which is something.
Maybe just I don't think it's like separate. You say the military, or say the Canadian Armed Forces and the Public Health Agency of Canada, we're tied at the hip. We're an integrated team, so it's not like one giving to the other. We're actually all part of the same team, working with these these data and having those active discussions. But maybe Major-General Fortin would add something.
I would simply add that the Canadian Armed Forces continue to plan, and they, in the absence of clear answers in certain things, we always make assumptions and work on those assumptions, and work to turn assumptions into facts. And until then, I know, coming from there, that the CAF are hard at it. They continue the planning, and they are poised to support. I will remind you that I'll only speak about the CAF to a point because I'm really aligned to the Public Health Agency, but I think it's safe to say that they are well poised to support with regional joint task force connected with across the country with the provincial counterparts, and they're really aligned to determine the gaps, the risks, and mitigations, and anticipate potential problems.
Jason Kenney said that he expects vaccines in Alberta by January 4th. Is that a date that's been given? And respectfully, Dr. Njoo, can you expand on your comment that people shouldn't be so obsessive about dates for vaccine arrival?
I can't. Thank you for the question. I can't speak for Premier Kenney and what dates he's using or how he's getting information. I can just say that we continue to work, at least for myself and Dr. Tam, at sort of the public health level with our counterparts. So that would be Dr. Dina Hinshaw in Alberta, and obviously the other chief medical officers of health. I think maybe to expand on the point you said about the delivery dates of the vaccines themselves, certainly that's important. Once we actually get the vaccine, then we can actually proceed with the vaccination. But I think the point I was stressing, but also Major-General Fortin was stressing, is that what's maybe more important at this point is not to focus on the dates per se of the actual delivery of the vaccines, but making sure that we're prepared, that we have the training exercises, that we have discussions with our counterparts in the provinces and territories, so that everyone's, as they say, on the same page, that we're prepared, that we're looking at all sorts of contingency planning in terms of unforeseen circumstances. Obviously, bad weather in Canada during the winter, accidents, all those things are taken into account so that when the vaccines actually do arrive, Canada's ready. So I think that's the main point we want to stress.
Unfortunately, this is the our spokespeople have a meeting to attend at 1:30. They really have. That will be all for today's technical briefing. That will be all for today's technical briefing. We'll be back next week. Thank you.